Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there are no new cases of COVID-19 to report. The total number of cases remains at 325. There are no individuals hospitalized and no one in intensive care. As of this morning, 304 individuals are listed as recovered. There are 14 active cases. An additional 287 lab tests were performed on Friday, 678 tests on Saturday, 784 tests on Sunday, bringing the total number of tests to 66,717. Over the last few days, Manitoba numbers have continued to be good, but we need to remain vigilant to keep our numbers low. We still expect COVID-19 to be around for some time, so we need to continue to live with this virus and continue to practice all of the things that Manitobans have been aware, well aware of the protective measures we need to take over time. So frequent hand washing, maintaining the physical distancing, and as we move forward, staying home when we're ill is going to be vital to protect ourselves from the spread of COVID-19. Those at increased risk of severe outcomes to COVID-19, those over age 65, those with underlying medical conditions, those with immune compromise need to take extra caution to ensure they're not being exposed to COVID-19. Hand hygiene, avoiding crowded spaces, enclosed crowded spaces, to ensure they're protected from COVID-19. Manitoba has been experiencing quite a hot summer, and extreme heat is a potential risk for anyone. Staying safe while it's hot and drinking enough water, staying cool on hot days is important. COVID-19 can make that more difficult at times. To ensure you stay hydrated, pack extra water when you go out. Many public fountains are now closed. Many retail stores may not be open for purchase, so need to plan ahead on those hot days. Check for the hours of public spaces and facilities you plan to visit to cool off, such as malls or libraries. Those hours of operation might have changed because of COVID as well. Again, vulnerable populations should take extra care. Heat can stress that body and reduce a person's capacity to fight off infections, including COVID-19. Ensure you check in regularly with vulnerable individuals or socially isolated community members, friends or family. Contact people by phone where possible to reduce the face-to-face interactions. More details can be found online at manitoba.ca/COVID-19. I want to continue to remind people to be kind to each other, avoid fear and stigma as we deal with this pandemic. Those fear and stigma are not going to reduce the impact of COVID, and in fact will probably have the opposite effect. Spreading misinformation or gossip is also not helpful. So I want to encourage people to continue to access credible information about COVID-19 at manitoba.ca/COVID-19. And I'll turn it over to Lynette.
Thank you. I'm Lanette Siragusa, Chief Nursing Officer with Shared Health, and I wanted to start today by providing an update on home care services. So earlier today, the Winnipeg Regional Health Authority announced a phased approach that is underway to restore home care services. And I can confirm that every region in the province is also undergoing the same work, planning to restore the services for clients and their families. The services that I'm referring to today are specifically the Priority 1 and 2 services, which include meal preparation, applying and removing compression stockings, and helping clients to get dressed. Throughout the spring, when we were at high active levels of COVID, home care case coordinators were in regular contact with clients and families to make sure they checked in and followed up on any emerging concerns. And now that the curve has been flattened, home care coordinators continue to contact clients and families to discuss resuming these services and whether they are still required. So I do just want to remind people that this is not a return to normal. Additional precautions will remain in place to protect clients and staff during home visits. Clients will continue to be screened for COVID-19 prior to each visit. PPE protocols will be followed, and guidelines are regularly reviewed and supply levels monitored. So this is not a process that's going to happen overnight. It will be gradual and prioritize those clients with the highest needs. So we do want to thank the home care clients and their families for their continued patience and understanding as we work to safely restore these important services. Wanted to also provide some statistical update on the testing of healthcare workers. So we have not had any positive COVID-19 tests involving healthcare workers in nearly 7 weeks. 615 healthcare workers and first responders were tested for the virus in the past 2 weeks, including 279 in the past 7 days. So since the start of the pandemic, 26 workers were tested positive for the virus for non-travel related reasons, and all 26 have recovered. Also, just a quick update on the isolation centers. So to remind everyone, there's 2 centers right now up and running for those who need to self-isolate but are unable to at home, or for vulnerable populations who are experiencing homelessness and need a safe place to self-isolate. We can report that 27 people are currently using the hotel program, and this includes 8 people that were accepted into the program within the past week. The shelter program accepted 7 people into their shelter or their facilities in the past week, and there are currently 6 people at the site. And also testing sites. So in the PAW, there's a community testing site that will be moving to a new location. Starting today, the testing site will move has moved from the Royal Canadian Legion in the PAW to 320 Fisher Avenue. So we want to thank the Legion for sharing their space with us over the past few months. And the hours of operation will remain the same at the new location. The site is open Monday to Friday from 9 a.m. to 4 p.m. with a break for lunch over the noon hour. So we encourage anyone who is experiencing symptoms consistent with the virus to please go and get tested. And a full list of locations and hours of operations are on our website, manitoba.ca/COVID-19. And with that, we can ask some questions. I think we're starting in the room. Is that right, Kevin?
Thank you. We have a number of reporters on the line and a number in the news conference theater. We'll go to the news conference theater first. We remind all of you to please ask your primary and secondary questions. We'll start with Steve from Canadian Press. Go ahead.
Hi. Dr. Roussin, there's been discussion about having the CFL use Winnipeg as a hub city. Have you been consulted on that, and what is your advice to those who might say, well, we've had the lowest number of cases here, comparable to any CFL city, and we should have athletes here, perhaps families, perhaps others as well?
Yeah, so we haven't had a specific discussion with the CFL on that. Certainly, we've provided some risk mitigation strategies to many of our professional sports teams, including Winnipeg Football Club. So we still have ongoing discussions, and I think that given our numbers, there's a possibility that a plan that would meet public health requirements could be put in place, but we don't have anything specific on that as of yet.
And so there's no specific public healthcare plan that would be for this scenario to discuss issues such as whether family members would join the athletes, periods of self-isolation, that sort of thing?
Right, yeah, we don't have a specific plan as of yet for that.
Are you in favor of having Winnipeg as a hub city?
I think there could be benefits, like we said, is that we have to learn to start living with this virus. We have to try to find ways to get back to the things that we enjoy doing, but we have to ensure we're protecting the public as we do so. So we'd have to take a very close look at any plans that are submitted, and we'd provide the feedback for that.
Make Josh go.
All right. When we, this is for Lynette, with the WRHA resuming home care, they've been talking about the curve being flattened a long time, for a long time. Why did it take so long to resume in-home care for these people? And do you have any examples of where those situations may have been stressed beyond maybe what was acceptable due to not having that in-home care?
Yeah, I don't have any specific examples that were reported to me, but certainly I would expect if the WRHA received them, they would address them. And I would say the reason for delay partly is because staff were redeployed to other areas like testing sites and screening and things like that. So as we move people around and shift our resources and try to find a balance between living with COVID and getting back to normal, that's part of the process.
My second question is for Dr. Roussin. You talk about the vigilance and needing to maintain all the things that we've talked about since the beginning of this. Is that message getting old? Are people starting to tune it out at this point? Because you go out in public, there's a lot fewer people who are social distancing, people ignoring the signs in grocery stores to maintain 2 meters, all the rest. Is the message getting old? How do you keep people maintaining those protocols that have been in place for months now?
Yeah, I think it's certainly a risk when we have messaging that's been out for so long that Manitobans have really stepped up and had to sacrifice a lot to follow a lot of our messaging, and then combine that with relatively low numbers over the last number of weeks. So we have to ensure we continue to message. We can point to other jurisdictions that aren't seeing the favorable numbers as us as a risk that could be still out there for us if we don't remain vigilant. And that's we hope Manitobans will continue to follow our advice and keep this virus at bay here.
Dr. Roussin, I'm wondering if your views on mask wearing has evolved over the months, and what places would you recommend that folks wear a mask in public?
Yeah, so they definitely have evolved over time since the beginning of the pandemic, where we were messaging early on that really messaging against face mask use by the general public to more of a accepting nature with it. So certainly in situations where people can't maintain the physical distancing, then certainly using a face mask is reasonable. We're not anywhere where we would be mandating it. Certainly not with the evidence right now, and certainly not with the level of virus that's circulating in Manitoba right now. So there's a lot of things out there. We certainly don't want the messaging to focus on the use of face coverings to detract from the importance of all the other messaging, the hand hygiene, staying home when you're sick, the physical distancing. But it has its place. And in addition to that, they have to be used properly. So we all see the people wearing the masks, not covering the nose or the mask under the chin, and that carries risks of its own with it. If we're touching our hand or our face more often when we choose to wear a mask, that's setting us up for exposure as well. So there's a lot of issues with the masks that we're not mandating it certainly in Manitoba, but we're going to follow it closely. And just like most things in this pandemic, our messaging does evolve over time.
Do you see a value of wearing a mask, let's say when you're going grocery shopping, and when you're in public, do you wear one?
I don't wear one when I'm in public. I'm certainly fortunate I don't find myself in situations where I can't maintain physical distancing, though. But, for brief exchanges where you can maintain physical distancing, wearing a mask is less important. It's more so in those places where you can't maintain that physical distancing, then you could choose to use that in addition to all the other protective measures.
Dr. Roussin, I know that we do still have that the federal quarantine in place for anybody that is coming over from across the border. Essential workers obviously don't follow into that, but as you look south of us and see what's happening with cases surging there in a lot of states, do you have concerns, and are you looking at possibly adding in any more provincial restrictions or asking for essential workers to be tested more often?
Well, certainly the epidemiology in our southern neighbors is concerning, and our risk in Manitoba continues to be importation of the virus, and so I certainly don't foresee any lifting of the international travel restrictions anytime soon, although that's not dealt with by the province. But I think the messaging is clear. I think the essential workers have been following guidance quite well. So we've seen cases being imported. What we haven't seen is large contacts to those cases because these professionals are following our advice. So as of right now, we're going to keep on with what's gotten us here, but always monitoring it going forward.
It's been very hot here the past week. A lot of people have been taking advantage of our beaches and our lakes. I know we've received pictures from people of very packed beaches. What is your messaging to people there? They are outside, yes, but still not, in some cases, maintaining that physical distance.
Yeah, and I think it's been a tough time, and then we finally get a great summer, so people want to get out and enjoy it, and I think they should. I think people should get out and use appropriate precautions, stay hydrated, sunscreen, all the usual advice. But we're not done with the virus. So even though outdoor situations are much less risky than crowded indoor, when we're outdoors, we should still try to maintain that physical distancing whenever possible. So even though you're out there enjoying the time at the beach, keep in mind we're not done with this virus. Try to maintain that physical distancing.
And I just wanted some clarity. I think it came out about a week and a half ago where you did lift some public health orders on travel. We had a couple questions from people when it came to professional sports, if they were coming from anywhere within Canada, no need to self-isolate?
That's right, not under the orders, but we worked closely with those teams to have protocols in place. So those players will be self-isolating for 7 days under the team guidelines, with frequent testing during those 7 days. And then the following 7 days, they're self-isolating other than team activities. So not going out and about Manitoba, just with the team.
I'll start with going back to the masks. We've seen many municipal regions in Ontario decide to pass bylaws for masks. Can you maybe explain what's different between those areas and our area and why not we're mandating masks here?
For right now, it's the level of circulation of this virus. So a lot of those places are dealing with relatively higher rates of circulation of that virus, so they're doing whatever they can to try to limit the spread. Right now, what's got us here has kept us here, and so we're going to keep on with the successful things that we've done, always reviewing the evidence, always reviewing these type of factors like this, knowing that we may get to a point like that. But just like anything else we talked about earlier about the messaging fatigue, we want to implement public health restrictions when they're required, because we know if we have them in place too long, you get the compliance fatigue with it. And so it's something that we have at our disposal should we need, but right now we don't see the need to mandate mask use here.
Right, and the debate between like aerosolized droplets and airborne illness, there's that open letter to the WHO. Is that one of those kinds of pieces of evidence that you would be looking at?
Well, certainly if there was more that came of that, we've learned a lot about this virus. There's a lot of cases. We had many cases in single days here in Manitoba. So I'm confident that the major spread of this virus is through droplet spread through people who are displaying symptoms. So there certainly is asymptomatic spread. There's no doubt. There's documented cases of that. It's not what's driving this outbreak. There's times when the virus can be aerosolized. That's usually during medical procedures. It's not what's driving this outbreak right now. So we'll continue to look at any evolving information, though.
Okay, folks, we'll go to the telephone now. From the Flin Flon Reminder, Cassidy, and once Cassidy's finished his questions, the other reporters on the line can jump on in. Go ahead, Cassidy.
Hi, thanks. It has been about a week since the public health order restricting travel to the north was lifted. There hasn't been a conference since then. I was just wondering what exactly caused you to make that change.
That's just the same as any of the other lifting of the restrictions. We put these restrictions in place as soon as we felt they were necessary at the level that we thought was necessary, and we'd only keep them in place for as long as we felt they were necessary. And so as we saw our numbers declining over time, as we had the healthcare system up in its response mode, our testing capacities increased, then at that time we could not justify leaving those travel restrictions on any further, so they're lifted.
And as a follow-up, I think a lot of us here above the 53rd are now looking to maybe travel down south, meet up with family, meet up with friends. Do you have any recommendations to ensure or to lower the risk of bringing the virus back up to the north?
Yeah, I think it's the general messaging that we've had. So no one should be traveling or really going out anywhere if you have any symptoms of respiratory illness. You shouldn't be visiting anyone who has respiratory illness. Frequent hand hygiene. And trying to maintain that physical distancing whenever possible. So that messaging works in that situation as well.
From the Carillon, Greg. Anyone else on the phone have questions?
Yeah, CDCJOB. How many cases right now have been linked to travel in Manitoba, of the active cases?
Well, of the active cases, I don't have that number offhand of these 14 active cases.
Okay, just as a follow-up, obviously the province has relaxed the self-isolation rules for people coming from Western provinces and territories and Northwestern Ontario as well. What do you make of kind of where we stand with our active case count at this point, given those restrictions loosening a few weeks ago?
Yeah, I think that our numbers are still favorable. The cases that were related to travel, some of the ones that already had exemptions, again, didn't have many community contacts. And so we're still seeing that our numbers are remaining favorable. So, I think that the epidemiology in the Western provinces justified lifting those restrictions, and we're going to continue to watch the rest of Canada and lift the remaining restrictions when we think it's safe to do so.
Gavin from Radio Canada. Dr. Roussin, I was wondering if you could give us a bit more details about the case of that person who took 3 planes while infected with COVID-19. Was the person symptomatic at this time? And if so, how did they manage to get on 3 planes as far as you know?
Yeah, I don't have a lot of the details. I know that we announced those flights because they were what we would call in the infectious period during that time, and so because of the risk of mild symptomatic spread or even asymptomatic spread, we'll usually consider someone infectious 2 days prior to the onset of symptoms. And so that's likely what we were doing with those flights, but I don't have the specifics on that individual.
There's Stephanie of Syragusa City News. Just wondering if you can tell me
how many home care clients did have their services suspended during COVID?
Yeah, we'd have to talk to the individual regions to find that out, and I think it ebbed and flowed depending on the conversations that were happening with the clients and the families. So they were in contact regularly, and they would adjust the schedule based on the client's needs.
Okay, do you have a ballpark number by chance?
No, I don't, but we can see if we can find that out from the different regions. But it was a ever-changing number, I would say, depending on what was happening with the COVID over the last couple of months.
Okay, and can you just clarify which clients won't be able to immediately resume home care services? That said, some with people with personal health risks won't be able to get their services resumed right away. So what does that kind of involve?
Yeah, so it's more the services that are I don't want to say less essential, because when you're in home care, they're all essential, but things like if there's family that can support meal preparation or helping to get dressed or helping to put on stockings, then they may continue on with that. If there's clients who go to the cottage for the summer, we may have to look at how do you ensure services or adapt the services based on travel requirements and things like that. So it's really based on individual needs and what the circumstances are with the individual.
Dr. Lisa, Marina von Stackelberg from CBC News here. So in the last 2 weeks, we've seen these 12 new cases. Can you provide us a bit more detail of where these cases specifically came from? Like, are any of them connected to the Manitoba airline passenger or to the person that went to JT's store?
These were mostly related to travel. They would be outside of the province and outside of the country as well. Not aware of any of the cases that were connected to the southern case that we announced going to that grocery store. And so we're not really discussing the specifics of people's travel for the most part. So most of those cases are related to travel.
And when you say related to travel, do you mean those people, the people that are infected, are the ones that were traveling?
That's right. So there's many of them. I don't have the numbers right in front of me. The majority of them are related to travel themselves. Some of them are household contacts of those who traveled.
And then just to follow up as well, we've seen so many of these cases involving truckers. Are you considering changing any of the recommendations or restrictions? Obviously, they're an essential service coming in and out of the province, but we have seen so many of these cases involving truck drivers.
Yeah, and like I said, is that most of those, or all those cases that we had, they attended testing early. There's minimal community contacts, and so they're doing everything that's been asked of them. And so, unfortunately, when we are updating Manitobans of where these cases are coming from, then comes the stigma. And we've heard of cases where truck drivers have been declined services, even healthcare services. And so this is the downside to displaying too much information, is that we stigmatize groups. And so truck drivers have been professional. They've been doing their part. They're keeping our supply chains going, getting tested frequently, and limiting their community contacts. So we're not going to change anything there. I think that they're doing their part at keeping us keeping our supply chains going and keeping us safe.
And just on that point, obviously there's the health recommendations for everyone, but is there anything specifically that you would like to see truck drivers doing in order to slow and stop the spread of it?
Well, we've worked with the Trucking Association and discussed these type of guidelines. So very closely monitoring symptoms, limiting contact in large groups during their returns, and we've seen that they stepped up to this. Where although we're seeing these cases, they're being tested very frequently. They're self-isolating when they're ill, and there's very few community contacts when we do find cases.
Roussin. Colin Clark with Brandon's son here. I was wondering how the supply of tests is right now. Is the province getting all the tests it needs?
Yes, our capacity is outweighing our demand at this point, and so we're not concerned about our testing capacity at this point.
Thank you. No follow-up.
Let's take a few more questions from the floor. Anybody in the news conference theater?
Yeah, sorry, you said that some truck drivers have been denied some care services. Could you give us a bit more detail on that?
Yeah, I don't have specifics to share, and it's mostly just information from truck drivers emailing me, advising me that they've been denied certain services. Some of them have been healthcare related, and so I just want to keep that message out that stigma is not what has got Manitobans where we are, and so stigma, fear, hate isn't going to get us anywhere with this, and so. And so that's a real risk when we start identifying cases and where they came from, and it's a challenge to public health to ensure Manitobans feel informed, but balancing the needs of everyone, including like we said, the most recent examples are these truck drivers.
Does that raise any concerns for you that people are going to get health care and being denied because of COVID?
It concerns me, period, that a group of individuals are being stigmatized. We've said right from the beginning, public health will advise on measures that people should take, and if there was any risk factors that public health felt should not be seen somewhere, we would advise people of that, and certainly we're not advising people to deny service to truck drivers.
Dr. Roussin, in recent days, there have been more than 700 tests. That's a lot of tests for a province where there's not a lot of virus. And we know that medical people are being tested, truckers are being tested, but who are all these people who are coming forward and being tested? And you get hundreds and hundreds every day.
Yeah, and so I think it's that balance, right? So we've always said that the most important measure is the positive test rate, not the number of tests. But I think that as the pandemic first hit, testing capacity was a challenge. So we got on this, on the role of announcing how many tests have been done, but it's kind of a unique situation where we don't usually worry about how many tests have been done for a condition. So, but yeah, there's people with mild symptoms being tested. There's asymptomatic people being tested. We're testing people admitted to hospital or offering testing for that. So it's a mix of that.
A lot of asymptomatic people going for tests then?
There is asymptomatic and mildly symptomatic people attending.
Getting back to Brittany's question, last week the Manitoba Trucking Association came forward with some stories about truckers being refused service in restaurants and the like. But you're saying some are being denied healthcare services?
Well, healthcare related services. So, I just think it's relevant that it's been healthcare related and it's individual reports by truck drivers. So it's not, I'm not hearing it from a system or any review into it by us. But I think it's just relevant, just another example of how we can run into stigma with these type of conditions. So I just think it's just important to note that there's been important services, not just services that are nice to have. So yeah.
And when you use, it's a broad category, healthcare related services, that can range from surgery in hospital to maybe massage therapy on the opposite.
That's right. Yeah.
spectrum.
Yeah, and so what I would say is that I'm not aware of part of the sort of the Manitoba healthcare system denying services like this. It would be more private type providers. Allied Health is what I've been informed of.
And do you understand why somebody theoretically, like a massage therapist, might be reluctant to treat a truck driver who
Well, I mean, I don't think we, necessarily are screening all occupations for anything. There's people who are traveling now can travel outside of Manitoba and things. So I think that screening for symptoms of illness is really important, and that should be everyone. And having that hand hygiene in place and all these other measures are far more important than trying to stigmatize a certain group.
When we talked to you guys about a week and a half ago and some of those public health orders were lifted, some people on a one-by-one basis would be allowed to come in for their job and not isolate if they were going straight to work and to a home or wherever. Do you know how many people you guys have seen that have asked for that?
Yeah, so we didn't, it was articulated that way in some of the orders, but we didn't really have a system for that. It was more for business sectors to come forward with a plan. And if a business sector came forward with a plan on how they could do this, then we would review it. And so we don't have any specific examples of that.
Ms. Syragusa, I was wondering if PPE has been an issue for home care workers. Is there enough PPE for all home care workers throughout their shifts every day?
Mm-hmm. So we've been making some good progress on the PPE front. Our logistics team have now implemented the technology where we can actually track the incoming and outgoing PPE. So we have a much better understanding of the whole supply chain process. And the markets have opened up now too in a way that we didn't see in April. So before, when I was only looking 2 weeks in advance because there was so much change on a global scale, we are looking more secure now than we were previously. So that has not been the driving cause of the home care. We do believe we have enough right now, but as we see what's going on in the States and we wait to see what happens with COVID in the fall, like, we just have to be cautious. We're also continuing to look at our protocols, so whether we have extended use and in what situations are the highest risk situations to make sure both the staff and the patients or clients are safe. So,
Any rationing of PPE to home care workers right now?
not that I know of. The guidelines were set a few months ago and those still remain in place. And we will be looking ongoing if and how we need to change them based on the evidence that comes out.
For the past few weeks, there's been nobody in hospital when we've seen these updates from you, which is great news. But there was a report a little while ago that somebody had been moved out of hospital and was at a different care facility. Are you guys still tracking that? Are we seeing people that are in other care facilities with COVID but not necessarily in hospital? I believe it was Riverview at the time.
No, I'm not aware of any such case.
Yeah, I'm not either.
Can businesses put in their policy, like, no mask, no service? Or is that kind of their choice, or is there any advice on that?
Yeah, so that wouldn't be the public health's advice. It's not certainly not in our order. What a private business does within certain limits, then it'll be up to them to do that. So, I mean, it's something to consider. I think that the things that have made Manitoba successful right now is staying home when we're ill, screening for symptoms, hand hygiene, physical distancing, and that's what I would continue to have people focus on. Masks and proper use of masks is an additional benefit in certain circumstances.
All right. Well, thanks, everybody.
Thank you.